It strikes me too that there's another potential that I'll elaborate on at the event that's more than just the monitoring, but is also the public leadership. That the internet has created its own pandemic of hypochondria. That H1N1 kind of played on. That people really take the most sensational, and it's a leadership void. Right. That in a vacuum of information, when there's no legitimate authority, people could just make stuff up. So the benefit of having these ICUs sort of participating in this larger public dialogue is they become the authority. They're the ones who are able to say, the reactions that we're seeing are not that crazy. People should relax. Don't rush to your emergency room.
That's a fascinating idea. In fact, what they become is a moderating influence. Because one of the things that happened during H1N1 is that you simultaneously had people saying, the sky is collapsing, this is going to be horrific. Yeah, there was a possibility, but a very small possibility, versus, no, this is all a sham, this is drug companies trying to sell you stuff. This is not going to be a problem, which was also a possibility, but again, not a small possibility. The reality is there's uncertainty, and the uncertainty sort of heads towards a more moderate kind of thing.
Well, and the flip side of the need for that moderation is the acknowledgement of limited resources.
Exactly.
That there are going to be instances in which you have to have sort of graduated vaccines or graduated immunizations. There's limited beds in hospitals, limited room in emergency rooms, and if you can convince people to be moderate, then it helps in terms of the allocations of those limited resources.
Right. Exactly right.
Now, do you? Obviously, as someone who, if you don't mind me referring to you as such, is a leader, I think, in terms of this type of networked and collaborative research. There's two questions I have. One is whether there's institutional change that's required to help enable this, whether it's supporting individual medical professionals, especially with regard to the getting credit, like that they're not going to be the big name on the paper. Can they still get the institutional recognition that they're providing an important part? So they're given more time, the same way you described the events, that we recognize it's good to have people to have good dinners, to have good walks out in nature. Does that apply here? That we should be affording ICU health professionals time to communicate via social media, time to involve that type of network communication. And then the follow-up question to that, on an individual level amongst medical professionals, do you think that there's a different shift in how they think about their work and think about the sharing of their work as part of this emerging type of collaborative research?
So it's a very complex question which has multiple different dimensions to it, starting with the whole question of academic recognition. And certainly when you're an academic physician in a teaching hospital, in a university, the university looks at your productivity as a researcher. And the simple way of doing that is to look at your publication list, see how many times your name is number one, and how many times it's the last name on the list of authors. And
it matters.
Right, and it matters. And in fact, this particular model, which would be infinitely more impactful, wouldn't actually have a first author or a last author, and shouldn't, because there isn't one person that you should ever be able to point to as being the person who was the senior author or the person who did.
It's almost like you need a different metric, like every time the study was tweeted. Because you participated in the study, you get a little micro point that adds to your standing in terms of the research that you're providing.
And I'm sure it's possible. I mean, if you look at physics, the list of authors on a physics paper often runs into the hundreds, and they've obviously found a way.
They've shifted their expectations in terms of how they recognize participation in research.
Exactly. And it may require a fundamental rethinking of how that's done. Equally, it may ultimately, for any one investigator, be a relatively small part of his or her academic productivity. So you may well still be doing conventional research and running a lab or whatever.
But it strikes me, on your point of this having a potentially more substantive impact, that speaks to an overall shift in the way that research is governed and organized, that people will almost want to do less the individual research because they'll want the immediate impact. They'll want to participate in the collaborative projects because that's where they'll feel the actual reward of improving actual care delivery, medical research. So that brings me back then to the individual. Both within the context of continuing medical education, as to whether you'd start being recognized, say, for learning how to use Twitter or learning how to be a better communicator as part of what it means to be a good health professional. Do you see there a cultural, not so much blockage, maybe opportunity that gets doctors who may not be used to working in these collaborative environments, who may not be used to thinking about their work, even as you say, if it's only a small part, as part of these bigger pictures?
Well, it's a fascinating thought. First of all, clearly there are generational shifts in the way people think, and people talk about the millennialists as being a generation that has just grown up with the notion of large-scale collaboration. So my generation, the baby boomers, that isn't the way we saw the world. Although I think the way we saw the world, can see that there's an awful lot of merit in that.
The framework's there, but the practice was never there.
But equally, medical schools are changing the way they teach, and much more. And it maybe reflects the difference that changes with millennials. The teaching model is group things where people collaborate to do, to learn, as opposed to individual assignments where you write an essay and get judged as an individual. So maybe there's a little bit going on both within the context of medical education, but within the larger society and the constructs that imposes on the way people think, that would favor that. But the other notion that you raised, which I think is a very, very interesting one, is the need for social media and communications to become a core element in medical teaching. It's very clear that the healthcare system is abysmally backwards in its capacity to use IT as a tool for coordinating data, learning, and that sort of thing. A colleague of mine gave a talk, and he was talking about the problems with computerized medical records and how none of the systems talk to each other. And he said, if I order a pizza from Domino's, they will say, "Do you want such and such as you had the last time?" And we'll have it in such and such a time to this.
And those are thousands of franchises.
We can't even identify a patient.
It varies too amongst each health professional. Like for me, my general practitioner is very savvy. We communicate by email all the time. And certainly for her clinic, makes it more efficient.
Yes.
Because when she needs you to come in so she can bill it against OHIP, she'll do that.
Yeah, right.
But lots of times you don't need to. It's just a quick back and forth.
Exactly.
My GI, my gastro specialist, doesn't use email at all. And her clinic's a mess. She's always late. Like subscription renewals or prescription renewals are difficult to get. Follow-ups and tests are difficult. And it speaks to a different digital divide that applies to the system in terms of each health professional's literacy and capacity to deal with this new technology. And I want to come back to my other point around authority and public leadership. That I as someone who's sort of trained in political science, have always been disturbed at the way the internet has provided this kind of leadership vacuum. And I personally am really interested on a public health level to see, not necessarily on an individual level, maybe on an institutional level, health professionals representing in the world of social media, being able to not be in terms of an online nurse or an online doctor, but being the people who share the articles, who participate as individuals, as even institutions, as we were discussing earlier, moderation of the public's understanding of health, of the public's understanding of pandemics, but also more modest and personal levels of health. Do you see that starting to happen, and do you see this type of collaborative research as being a catalyst, especially in the context of ICUs, of playing that type of role?
So definitely speaking of catalyst, I do think I'm struck by the lack of people with any kind of familiarity, comfort with social media in healthcare, to the point that when we try to set up a website, it's really dull. It's really hard to get going.
And that
so I think there is a need for that. But I think that perhaps something like this could be a catalyst for that.
Well, and I suspect part of that is a symptom of time.
Yes.
That health professionals, more so than other normal professionals, have incredible scarcities of time, which is why I see it falling within continuing medical education and falling within research, that they're allocated time to learn these skills. The same way that bedside manner
Yeah,
for a lot of health professionals
Yeah.
is an important professional skill. That
Yeah.
when you're treating someone,
Yeah.
you want to be able to make them feel relaxed. You want to be able to get information from the patient
Yeah.
that helps with the delivery of care.
Yeah.
And it's a matter of starting to recognize and understand that there are electronic equivalents
Right, exactly.
to that traditional notion of
And
bedside
some of that
manner.
is happening, because I guess the other answer to that question is that even in the last 12 to 18 months, I've been really conscious, particularly amongst our trainees, of a shift that's taking place.
Mm-hmm.
So we'll be doing, I'm a trauma surgeon, we'll be doing rounds and we'll be talking about something, and I'll notice that my fellow's got his iPhone out, and I'm like, come on, focus on what we're talking about. And he'll say, here's what it looked like, and he'll show me the incision of a patient we've just been talking about, or we'll say, okay, here's a paper on that shows such and such and such and such, or here's the X-ray.
So
they
it's
are
using the
actually,
device to augment what you're talking
yeah,
about.
they're using the device in real time to access our hospital medical records, to describe what they saw. This is the problem that we have. This is
Mhm.
what somebody else has done. So they are becoming very comfortable with sort of stepping outside of the interpersonal discussion, which has always been a part of medical rounds, where you're primarily talking to each other, to using these devices that then hook you up with the IT or with the internet and give you that information.
Mhm.
So it probably is happening as a Luddite, it's probably happening much more quickly and much more intensively than I'm actually aware of, because I don't know how to do it yet.
Mhm, mhm.